How do I prepare for paracentesis? Are you wondering how to get ready for a paracentesis? This procedure is designed to remove fluid from the abdominal cavity, often to help diagnose or treat conditions like ascites. If you have a sensitive stomach, irritable bowel syndrome, or colitis, knowing how to prepare can make the process smoother and less stressful. First, it is important to have a conversation with your doctor about your medical history. Be sure to mention any digestive issues you have, including irritable bowel syndrome or colitis. Also, inform them about any allergies, especially to iodine or local anesthetics like lidocaine. If you have had previous abdominal surgeries, let your healthcare team know, as this can affect the procedure. Next, ask your doctor if you need to shower with antibacterial soap before the procedure. Some providers may recommend this step. You might also be instructed to avoid eating or drinking for a few hours before the paracentesis, but this can vary depending on your healthcare provider's guidelines. If you are already in the hospital, your care team will assist you with the necessary preparations. In most cases, you do not need to stop taking antiplatelet or anticoagulant medications before the procedure. However, always follow your doctor's specific instructions regarding your medications. Antibiotic prophylaxis is generally not required for this procedure. On the day of the procedure, you will be positioned on your back, often with your head slightly elevated. The area where the needle will be inserted will be cleaned with an antiseptic solution and covered with a sterile drape. A local anesthetic will be injected to numb the skin and deeper tissues, which helps reduce discomfort during the procedure. Ultrasound is commonly used to guide the needle during paracentesis. This helps minimize the risk of accidentally puncturing the bowel or other organs, which is especially important if you have a history of abdominal sensitivity or surgery. Once the needle or catheter is inserted into the abdominal cavity, fluid will be withdrawn for testing or to relieving symptoms. The amount of fluid removed depends on whether the procedure is for diagnostic or therapeutic purposes. After the procedure, a small bandage will be placed over the puncture site. Most people feel little to no pain afterward, but some may experience mild discomfort or dizziness. Serious complications are rare, but they can include infection, bleeding, or injury to nearby organs. If you have a sensitive stomach, irritable bowel syndrome, or colitis, you may be more aware of abdominal sensations. It is essential to communicate openly with your healthcare team about your concerns. Let them know if you have a history of abdominal pain, bloating, or changes in bowel habits, as these factors can influence your experience. If you tend to feel anxious or have gastrointestinal symptoms, consider asking about relaxation techniques or mild sedation options. Staying hydrated before and after the procedure, unless instructed otherwise, can help maintain comfort. After the paracentesis, keep an eye out for any new or worsening abdominal pain, fever, or changes in bowel habits. If you notice any of these symptoms, report them to your healthcare provider promptly. By following these steps and maintaining clear communication with your healthcare team, you can prepare effectively for your paracentesis. This will help ensure a smoother experience, even if you have a sensitive stomach, irritable bowel syndrome, or colitis.